Recently, President Jimmy Carter announced that he was diagnosed and treated for skin cancer, the fastest growing cancer. Joining us is well-known dermatologist Dr. Charles Crutchfield III. Thank you for being with us. He's with Crutchfield Dermatology in Eagan. So thank you for being with us.
Thank you so much for having me today.
We've been told that he has melanoma. What do we know about melanoma? It's one of the deadliest cancers.
It is. And, you know, when I talk about skin cancer, I'm also a professor at the University of Minnesota in dermatology, and I teach the medical students and residents. I talk about skin cancer. There's three main types. The first main type is called basal cell skin cancer, and that's actually the most common type of cancer, barring all cancers in the world. There are over 1 million cases diagnosed every year in the United States. The nice thing about basal cell skin cancer is it rarely metastasizes and causes other problems, but locally it can be very destructive, and that's why it needs to be treated. So about 1 million cases. The second most common type of skin cancer is called squamous cell skin cancer, and there's approximately 250,000 cases diagnosed in the United States every year. That can metastasize in a small percentage of cases and lead to the patient's demise. And the third type of skin cancer is called melanoma. Now, there are only about 30,000 to 40,000 cases of melanoma diagnosed every year in the United States, but it is the deadliest form. Anywhere from 20 to 50%, depending on the study you look at, patients will actually die from this type of skin cancer.
So it is one of the fastest growing cancers, the skin cancer is, but we know if it is detected early, that survival rate is very high, extremely high.
Yeah, the earlier the better, and in fact, if you catch it very early, the survival rate is approaching 99%.
Wow, so, that's awesome.
And the thing about melanoma, it's the cells that produce color in your skin called melanocytes, so it's really the dark moles that are changing and they're prone to skin cancer developing into melanoma. And we tell patients the things that you want to look for, we call a thing called cancer-prone skin. So if you have fair skin or blue or green eyes, blonde or red hair, if you have a history of working outside, say if you're working on a roofer, if you're a park ranger, if you're a lifeguard, lots of sun exposure, blistering sunburns, you're at high risk. Or if you have a family member with skin cancers, you're at high risk, and it's important to get your skin checked on a regular basis.
But everyone is at risk for skin cancer.
Absolutely. Some people are at a higher risk. And so what I recommend for everyone is having a baseline skin examination with your dermatologist, and based on your history and physical examination, they can recommend the appropriate interval for further examinations. It might be once a year, it might be once every 2 or 3 years, but that will determine how often you should be examined. Plus, you should be doing monthly self-skin checks.
So you mentioned briefly kind of what you should be looking for with the melanoma, but what other things what are the key messages on what are signs and symptoms of skin cancer?
I like to tell patients if you have any lesions that are changing in any way, size, color, or shape, or if they're becoming elevated, or if you have any spot that bleeds and doesn't heal on its own within 3 weeks. Now, if you're shaving and your razor catches and bleeds, that doesn't count. But if you're washing with a cotton washcloth and the lesion starts bleeding and it doesn't heal in 3 weeks, those are the things that you need to check out. And you'll catch 99% of all skin cancers if you mind those rules. Anything changing at all, or anything bleeding and not healing.
And the other symptoms, you wouldn't really notice anything else different?
Well, sometimes patients will notice unexplained blood in their bedding or clothing. You can investigate to see where it's coming from. There used to be an old promotional activity program from the American Academy of Dermatology, and they used to say, see spot change, see your dermatologist. And that's really the most important thing. Anything that's changing, and the vast majority of lesions that are changing are fine, but that's the point when you want to give the baton to the dermatologist and let them evaluate and let you know what's going on.
And there are certain areas of the body where you're more likely to develop skin cancer, the exposed areas?
Yeah, any area that you have sun exposure, the face, top of the ears, back of the hands, legs, are more common, but you can get skin cancer, and especially melanoma. You can develop it anywhere. So once again, any mole that's changing in any way should be evaluated.
So what can we do to protect ourselves against it besides being vigilant about checking our body for these signs and symptoms?
You know, in the old days, they used to say avoid the midday sun from 10 to 3. And I'm a realist. If you're going on vacation, you're not going to stay in your hotel room from 10 to 3. That causes to lose credibility as dermatologists. But what I say is be sun smart and enjoy the sun. That means wearing a broad spectrum sunscreen. And a lot of people are really key on the SPF number, which is good. You want an SPF of 30 or higher. However, that just protects you against burn. you really want to block UVA rays, and those are responsible for wrinkles and brown spots and skin cancer. So you need something that says broad spectrum or helioplex. Those are the things you need. And the key is to put a sunscreen on 30 minutes before you go out in the sun. It takes approximately 20 minutes for it to set up.
Good
and
advice.
Then you need to reapply it every hour to maintain protection. And the most important thing, sun protective clothing. And there are great places that offer certified sun protective clothing to protect from the sun.
Well, any final comments about skin cancer that our viewers should know about?
Yeah, once again, get a regular checkup. If you notice anything changing, see your dermatologist.
Well, Dr. Charles Crutchfield, it's so nice to have you with us. It's been a pleasure. And we'll have to have you come back when we can talk further about some of maybe the new anti-aging skin treatments that are now available and what works and what doesn't work.
It's been my pleasure, and I look forward to that.
That'd be great. Thank you.